Get started, I wanted to welcome all of you to the webinar. For those of you who don't know me, I'm Dr. Lauren Levine. I am your moderator and host this evening. As usual, we got a great turnout for the webinar, well over 300 people registered. Hope that everyone is staying healthy and safe and warm out there. I know a good chunk of the country is not so warm here in Southern California. It's about 75 right now. I commend you for being here this evening. Continue your dental education. I'm only going to speak for a couple of minutes. Just to do some housekeeping. I want to make sure that Dr. Roetzer can speak for as long as he needs. We also want to make sure that we leave time at the end for questions. Most of you have been on these webinars, so you kind of know the format. Tonight's a little bit different because a lot of times we just have a straight presentation. Tonight we're going to have a presentation for about 40, 45 minutes and then an actual hands-on for 15, 20 minutes. So I think it's going to be a nice change of pace. But because of the number of people that we have, we can't do verbal questions. All of you should have a GoToWebinar control panel on your screen where you can just type in your questions as you think about them. We don't do the questions until the end. I never know how many questions we're going to get. Sometimes it's 5, sometimes it's 65. I'll do my best to get to as many of them as possible. It's rare that we run out of time. We will do our best all those questions. So as I said, just as you think about them, type them in and we'll get to them at the end of the presentation. In the next few days, look for a couple of things. First off, this webinar is being recorded. So you will be sent a link to download and view that recording. So don't worry if you get distracted for a little bit or have to take a call or anything like that. You will be able to download the entire presentation. During the webinar, Dr. Roetzer is going to show some of the products and systems that he uses, which are exclusive to Golden Dent. I want to thank them, as always, for their sponsorship of these webinars. I've been working with Kurt and Jason and their crowd over there for at least 12, 13 years, if not longer. They're the ones that are bringing in these amazing speakers. They work with the speakers to develop content. They also handle the CE. Probably the most common question I get after the webinars is, how is the CE handled? From your standpoint, there's nothing you need to do other than enjoy the presentation. That's it. There's no registration at the end. There's no quiz or test or anything like that. We track when you logged in and when you logged out. And as long as you were here for the bulk of the webinar, I think it's like 60, 70%, whatever the case is, then you will be sent the CE form. That can take a little bit longer. The recording oftentimes will take about 2 or 3 days. The CE, sometimes they get it out by Friday, sometimes it's early next week. But when we have 300 plus people registered, it does take a little bit of time. So keep an eye on your inbox for that. So with that done, I'm thrilled to welcome Patrick Roetzer. He is a 1974 graduate of Marquette University School of Dentistry. He completed a 1-year GPR with the VA Medical Center in Martinez, California. His career is really unique in having founded the Carquinez Dental Group, now a major prosthodontic group in Valencia, California. After 35 years in private practice, he performed duties of professional relations director as well as regulatory oversight at Danville Materials. After joining the UOP University Pacific Arthur Dugoni School of Dentistry, he assumed the role of director of operative dentistry and co-director of international studies, and he's currently professor emeritus. He holds multiple patents on dental devices and lectures both domestically and internationally. Pat, we're thrilled to have you here and looking forward to the presentation.
Well, I'd like to thank you, Lauren, and Jason for putting this together, and Kurt for owning the facility that's housing this amazing group. Thank you so much. So we're talking about large monoblock composites, making them easier. With injectable bulk fills now and revolutionary matrices, with composite sculpting burrs and single medium polish compounds, we're able to do these things quickly. This is the Union City Dental Care Center where I participated in the AEGD program my last 2 years at the school. Loved it because I could bring in whatever I wanted. All I had to do was check with the clinic supervisor and say, here it is, here's the evidence, let's do some teaching. And they liked it because then they got the residents exposed to things that weren't in the formulary at school. Now, that being said, if someone had told me in 1971 when I was a freshman at Marquette that we could do the things we're going to be showing, I wouldn't have had the knowledge to appreciate it, because we couldn't do those things with the silicates we were trained with. Yeah, silicates. Okay, that makes me officially a geezer. So here's an interesting cooperative effort with Simon McDonald, inventor of the V3 ring and matrix and wedge system. This is the first time that he has done injectable composite. It's also the first time that he's hard sculpted with sculpting burrs. So what he's doing here is placing his quick connect band. The reason I like this is I've always been a favorite of the Toffelmeyer approach, because I could use different types of geometric bands. But what I didn't like about them is the fact that they're hanging off to the side. So what he has done is made a band that you can detach the Toffelmeyer from. You just saw that. And then these tabs allow us with the injectables to fix that band. It's only 35 micron stainless. So once you fix the band like that, you can do some burnishing and get a really nice contact. Remember, these bulk fill flowables or injectables, flowables really not the proper term anymore. The injectables, they cannot push a band, but if you have a 35 millimeter space, you're doing, or micron space, you're doing just fine. Now you can see he's pulling the tabs on the bicuspid and the molar. And then he goes in with that PPS instrument. That's the one that goes with my burrs, my sculpting burrs. If you want to, either incremental pack, heated or non-heated, you can use this instrument and not have to switch back and forth while you're packing and shaping. So you can see that he has never done this before, and he's doing it flawlessly. He's keeping the pressure on as he fills it, because you don't want to lift that out with the pressure off the plunger, because you can create a void. So now he's removing the wedges. After 60 seconds, you can pull the wedges off. He's separating that barrier. That's a gingival barrier by SDI. We're going to use also material called Cool Dam or Dam Cool, and that's from that's the same type of barrier gel, because it'll give you a nice temporary fix. He's got a little bit of adhesive on the mesial of 18, a little bit of adhesive on the distal of 20 that he attaches that to. And you can see we like to have him use a lot of water with our burrs. There's the acorn going to work to make the carve the planes, carve the triangular ridges, all the things that you want to be able to do. And now he's using his discs to lower that and make the entry for the floss much better. Now he's running the nano diamond on there, because he's used, you didn't see this, but he used also the Christmas tree, which is a 15 micron, as opposed to the acorn, which is a 50 micron. The 15 micron leaves a very smooth surface. The prosthodontist that replaced me in my private practice says I don't even use anything anymore other than that Christmas tree. But I just gave her some of the nano diamond, and she seemed to like it a lot. So we'll see if that changes her mind. So the bottom line here is he's using the buff now after the nano diamond. And I said, why don't you go back and clean that up a little bit with the real small acorn, which he did, and now he has a more functional anatomic relationship. Pretty good looking for a guy who has never done that before. So this is what we're looking at on limited depth of cure, no composite layering. Remember, we don't want the Richard Price knit lines in there, or whatever you want to call them. No internal shrinkage. Here we go. Second one. Okay, now this is me. We're exchanging these ideas via Zoom because he's in New Zealand. I like to put some little marks on the cusp tips. So I can line my cusp tips up on 19. Detaching the carrier, we're going to glue down the tabs. Again, I put adhesive on the teeth that are adjacent on the occlusals, but I don't etch those. This will stick just fine, but I want to be able to get it off when I want to get it off. So again, we're pulling the little tabs to make sure that 35 micron band is up against the adjacent tooth. Then we light cure it. That happens to be the Magic Cure by Strauss Dental, which I'm sure you can get through Golden Dent. If you can't, I'm actually favoring the woodpecker now because I know the inventor, evaluator, Richard Price very well, and Richard doesn't do anything other than perfect stuff, in my opinion, when it comes to light curing and testing and all that sort of stuff. That we need to have people like Richard looking at that. As people like Rugerberg and the other et al.'s retire, Richard's still out there doing his research. So you can see now after 60 seconds, I'm just tapping around to see how firm it is. 60 seconds, I should be able to take that off. In 90 seconds, it's pretty hard. So we're going to pull the wedges, and then we're going to strip that material off. If I etched it, it would be much more difficult to get that off. And you've got enough stick to hold those tabs in place. So now we're pulling the band off, and we're going to do what you saw Simon do. We're going to finish it now. I don't have the advantage of water because, believe it or not, I'm working in my kitchen great room area. The suction you see on the side is my Dyson. So this is truly makeshift dentistry, but you'll see you can get away with this if you're used to it. So here we go. Now I'm not using any water. I prefer to have water, not with the discs, but certainly with the sculpting burrs. They work better. So now I'm going to come in with my nano diamond, and I'm going to hit it using firm pressure. And once I see the high shine on there, and repeated runs with that bristle brush against the little dot of compound is a good idea. There's nothing on there with the buff. So notice the nice tight contacts and wide contacts. You follow the letters, it works beautifully. So that's what we did between Simon McDonald and myself to give you a recipe for monoblock restorations. So why am I so big on monoblock restorations? I'm going the wrong way here. Sorry. Okay, so this is Richard Young's. We're pre-wedged here. He's a BioClear guy. What I'm showing you now is this material that they provide that's probably the best disclosing media. And the reason I show this is because that's going to show you where the biofilm is, and they need to blast it off. Now, interestingly enough, you can see that there's a wide radius bevel on the buccal and lingual. And he took that D-min off. That D-min, if I was serving as my reb service as an examiner, I would have had to fail that person because they left it into the dentin layer. So he's got that. He's spinning out the matrix. He's filled it, and it's beautiful. And look what he's converted to. 70% enamel, 30% dentin, C factor of class 3. Normally, if you did a classic restoration following the GV Black, you'd have 30% enamel and about 70% dentin. So why do I think this is a good idea to do this? This is a letter I got from Gordon Christensen when I sent him my Raptor burrs back in '98. And what he's saying is that these polymer crowns would do much better if they weren't layering it like you do with a porcelain mentality. He said those layers tend to segregate off. Nice word for knit lines. So 10% above grade and sculpt with the burrs. Avoid soft sculpting. It's just a great time saver. Anyway, it was nice to hear from Gordon that he was thinking back in '98, we need to think monoblock on these materials. So this is Bulk Easy, the first product. This is Sean Chen, who's a very good chemist, developed the first version. This is a case on the clinic floor, main floor, and everybody was thinking, oh, how are we going to restore that? And I'm thinking, yeah, it's a nightmare margin, but we have this Bulk Easy material now. I think we're going to be fine. And I think we can use the paraband on there because that paraband cinches down through its geometry. It cinches down like the Elizabethan collar on a dog, and it seals off beautifully. So you can get that one from Practicon or the Greater Curve. I'm not sure if Golden Dent sells the Greater Curve. They don't, they should. It's a good product for this because I can't wedge that area. So I asked the student, do his first cut, let me look at it, take an x-ray, no, we need to go deeper. So he's got a bevel on there and he's got a nice box form, and then he fills it, and that fill took 15 seconds. We have bilateral cheek shields in because trying to do that with a rubber dam on is pretty difficult. And we've got a Svidopter in there that you can get from Practicon also. It's called a Sweflex. That thing will hold the tongue back and the fluid back. So bilateral cheek shields, if you can't get rubber dam on, work beautifully. So there's his finish. Could have pulled that in a little bit more in the distal, but it's 5 o'clock, we gotta go home. Here's another one. Again, paraband comes in, smooth transition. That depth of cure on there, that has to be at least 8 to 9 millimeters. But as you'll see from Jack Farrakane's work, that it's agnostic. This material is agnostic to the depth. It doesn't care. It's gonna set. So it's reasonable to say that most of us geezer docs would want to put some GI in there or amalgam. Not when we have this material. Bertolotti's been saying Bulk Easy is the material to use for your deep margin elevation. If you can get it dry and clean, then you can do it. So if you're having a problem with bleeding, Quick Stat 20% gel, 15.5% liquid ferric sulfate by Vista Apex, that will stop bleeding in that deep box. So here is what we call the geezer crown. This is from Gordon. So the scenario is 80-year-old patient needs numerous crowns, can't afford it. He's got no history or he's got no insurance. It's just a perfect storm. So you can see what Gordon is doing there. He's making a matrix, and then he's prepping the tooth, then he's filling the matrix with either Bulk Easy at that time or Hyperfill, and he's seating it on there and then carefully teasing it off. My feeling is I'll take a pre-op impression with the clear matrix or with any kind of a matrix material, and then I'm gonna make a model, but I'm gonna make it out of Mach 2. I can take either silicone mold release on PVS, or my favorite, which is alginate through an alginator, carefully measured and mixed to the proper mix, and I will get a very good margin. We've actually measured that. So fill the matrix then with Bulk Easy, insert the Mach 2 model, because now you have a Mach 2 model that you made off of that alginate, and then you have a model matrix complex. That's what we called it when we developed this technique. Separate, finish the margins, create the cement space on the intaglio with a burr, micro etch the intaglio, bond on the tooth, and cement it. See Martin Tellich's article if you can dig it up in July, August Dentistry Today, and that's a couple of years ago now, but you should be able to find it just by contacting Dentistry Today. He's a DDS PhD. He does a ton of these, and he does a beautiful job. So now we're moving into Bulk Easy Plus. So that's my friend, Nick Airley, who came in. He's now director of R&D at Zest, Danville Zest. And what he did was he figured out how to get the agglomerated zirconia in there. And that's a plus, because as you will recall, that's what set Filtech apart from everybody else when 3M came up with the agglomeration process. So he got the agglomerated zirconia in there because the patent is run, And now we have a material we call Bulk Easy Plus, because with that nano agglomerated zirconia structure, you've got a lot of wear and a lot of strength. So Jack Farrakane did this conversion map. And like I was saying, this material is pretty much agnostic to depth of cavity. He's showing 5 here, close to 5 with no change, but I suspect you can go to 10, you're not gonna have a change because it's auto cure. Let it go auto cure. It's also dual cure, so wherever light can reach, you'll get an even higher conversion. Notice that even after 360 minutes, the gloss and the wear resistance on that product is better than Sonic Fill or Sure Fill. That's significant. This is a real favorite of mine because Ali Sauter is one of the best guys in the business in terms of materials testing. He's using an application of ocular coherent tomography, and that will show you actual gap formation on the tooth. So this is Sure Fill 1, which was a kind of the great white hope of bulk fills because you place it in there and hit it with the magic lantern. Well, the problem is, at least in Sauter's studies, there's 100% separation from the cavity floor. In my world, that's sensitivity every time you bite on it and cold sensitivity. Look at Bulk Easy Plus, 100% adaptation to the cavity floor, and you can assume it's the same in the box. So that's what brought people like Troy Schmedding in. And you know what he's got to say here. Troy does nice work. He and I taught together for years. We had cubicles right next to each other. Used to play all sorts of rotten tricks on each other. Great guy. Take a course from Troy. He is one of the best. And then my friend Mike Nelson, who has almost 6,000 of these in place between him and his son. He's the dentist up in Redding, California, and he does beautiful dentistry. I've referred him so many patients because I know he's just a fine human being and a great technician. Now, here's something for you. We're still trying to standardize the incremental technique. I think this is a Richard Price study. I pulled just this slide out. And basically what he's saying, it doesn't make any difference what your skill level is or how low it is, because the whole group, only about 1/3 of the increments placed will fall within the desired range of 175 to 2.25 millimeters. And GB Black is saying, oh, why don't you just inject it and be done? Forget this layering stuff. So my friend, Michael Miller, I got a lot of friends. He's done a lot of work for me on my inventions and also the companies I've worked with. You've taken Reality, I'm sure, at some point. It's a great publication. He does good research. He developed a software program to calculate percentage of voids at the margin. And, whoop. Oh, there we go. Sonicating bulk fills and universals will actually create a Swiss cheese effect in one study. I was shocked to see that, but at least they were able, by changing their constituents, to make the percentage of voids go far lower. Bulk Easy, if you just change the needle size, you significantly decrease the percent of micro gapping. So that's a significant 0.168 to 0.017. With that study done at the IADR 2017 San Francisco, I advise Danville get that 17 out of there. They don't need it. It's a fire hose. They're going to go too fast. They can create a problem just by going too fast in terms of bubbles and marginal defects. Use the 19. I love to use the 20. The 20 is great for class 5s, little box preps if you still do them, fissurotomies. The 19 will do a beautiful job on your larger fillings or restorations, whatever you want to call them. And that's, boy, I'm having a hard time switching. Okay, so this is the push-pull technique. David Clark at BioClear developed an instrument to do this. I just use my CEJ and I bond while I'm pulling it, I have the assistant light cure those tabs of material. It's just part of the bulk fill material that holds that band against the buccal and lingual. And then with the same material, because this is very fast, it doesn't take long to get this. And you'll notice that the BioClear makes this metal instrument. I think the Contact Pro works fine, either one of them. And I don't need to change that needle because it's so quick to do that. I can go right into the fill of the material, and then one move from the light curing to the tack weld to inject the cavity. And bulk easy gives plenty of time to tack the band and then go to the fill, and assures a robust interproximal contact. So then simply cut the welded composite bands off the tooth while finishing. So this is the drop and drag technique. It's for our burrs, our sculptors. This is all I gave the students when we did our first selective on this. And it's based on the Linux carving manual, because what we're doing here is carving in planes. So you place those starting pits and 10% of overfilled bulk easy plus with the acorn burrs with the limit stops, you go halfway from pit to pit and avoid going from mesial to distal in one fell swoop, because that'll just create a trench. But then you finish those triangular ridges, the oblique ridges, marginal ridges, to find the grooves with this Christmas tree. So you just went from a 50 micron to a 15 micron in the Christmas tree. You can still use brownies and greenies if you want. We're finding it's not necessary because the Christmas tree is 15 microns, and then we hit it with a nano diamond. Now, why did I put this in there? Because this is part of this philosophy of this burr system. We need to find a way that we can carve quickly in stuff, composite that's already hardened. And again, I'm going to quote one of our better researchers, the burr standardized hand skills. So this is my 60 students in the selective. They have never injected. They have never injected composite. They have never sculpted hard composite, because we just didn't teach that at Pacific. We taught incremental fills. Now notice there's closed margins. There's no adhesive used on these. None. Look at the anatomy in there. And the interesting thing is what Jack Farrakhan said when he saw these. I visited him in Oregon, and he said, you know, it looks like these burrs kind of standardized hand skills, based on what I told him, that we had the best students and the least skilled students from the sim lab. And one of the guys that was on the lower end handed me his tooth. I looked at it and I said, this is gorgeous anatomy. And I looked up at him and he had tears in his eyes. My point is, give them the proper instrumentation, the proper materials, and they can do a beautiful job. So here again is my resident, carious lesions. He's going to prep it with a diamond 334 at 5,000 RPMs using the BN, very light touch. Then he blasts it with the Groban micro etcher with 50 micron in, because I want to get a pre-etch as well as take the biofilm off. Remember, biofilm is your enemy in bonding. Your phosphoric acid will not remove biofilm. So you need to blast it off. You're either going to use the bioblaster with aluminum trihydroxide or potassium carbonate for in the micro etcher, or you could use the 50 micron aluminum oxide and pre-etch the enamel. So now what he's doing is using that 20 gauge needle, and he can actually paint it on and do the entire restoration with one fell swoop, then come in and use a soft brush just to clean up the margins. At this point, we were still using sharpened, shaped brownies and greenies at 50,000 RPMs, another $2 down the drain. We don't need that with that 15 micron diamond on the Christmas tree. It will do what the brownie does. And then the nano diamond does better than what the greenie does. So these are being phased out, but that's what we were teaching at the time. And actually it was the prosthodontist that replaced me in my practice, my private practice, that convinced me we didn't need this. She says, I just use your Christmas tree on my class 5s and they're really shiny. I said, interesting. So lately I gave her some nano diamond to see what she thinks about that. So here's nano diamond. What we're doing now is we rub it in like rouge. We run that little bristle brush right in there, and then we go right to the surface with it. It's coated now. It doesn't fly around like the paste does. It stays where you want it, and it brings a nice high shine immediately. If I'm doing zirconia, I'm pushing real hard. With this, I don't need to push hard on composite. And it will do everything. Lithium disilicate, it'll do gold. And what you can see now is that once we use that nano diamond, then we go into just a cotton buff. That comes with the kit. And that dry one at 20,000 RPMs and a firm touch with this gives you that beautiful finish. So here we are. Welcome back to the clinic, the AGD, failing amalgam, crack in the back. We're gonna blast it. We got it prepped now. Try and leave as much enamel as we can. We've pre-wedged. We've blasted. You can see we're creeping up onto the cusp tips because I want to convert this into a compression rather than a tension phenomenon because we have a split tooth. It's asymptomatic, X-ray negative. So what we're going to do is we're going to ensconce that sort of like the BioClear technique. At University of Michigan did some beautiful research on compression of composites versus tension. You always want to put them in compression. So now here's my, I always say overfill 10%, and residents are really good at overfilling. So now you've got the composite in there. Remember that you fill from the proximal box back and allow the composite to push you out under pressure so you don't get bubbles. Then smooth it off. That, by the way, is the BioClear newest universal ring. It's pretty potent. Note that the BioClear is able to grip any height, shape, or anatomically anomaly, and that it's true. You can even use it on a lower bicuspid and a bicuspid. It'll fit. So here is my resident now starting the rough out of the anatomy with the 50 micron acorn, smooth and finish with the Christmas trees, and then hit it with the nano diamond. Got a little anatomy going there, and we're up on the cusp with the material. So keep in mind that agglomerated zirconia the formula is going to give you good compressive strength and wear, but you have to respect the fact that it wants to be under compression, not tension. So here's an interesting case from the AEGD. This was one that was done a couple of times, trying to come in from laterally to not cut through the marginal ridge, and then using GI. The problem was multiple attempts, multiple times failed. So what the resident and I observed is that we have an existing composite there. Let's take that out and just box it down, which is what we did. We're not going to use the tunnel prep. It failed 3 times. So we take that out, rubber dam clamp in place, rubber dam in place. We complete the box, then we use the laser to cut the tissue away because the tissue was pretty high. Then what we can do is we can blast it. In this particular case, we're using bicarbonate to remove the biofilm, and it's in the etch master, potassium bicarbonate. You could also use the bioblaster with the slurry of aluminum trihydroxide. The important part is to get the stuff out of there. Nice thing about this is that I can bend that needle. I could bend it almost 180 degrees so it's back action. So now what we do with rubber dam in place is we do our etching and bonding. This is going to be total etch. We're going to use 3M. And what we're going to do is light cure it, because when we take it, we have to take that dam off to fill it. So here we are, we got this is the greater curve band in place, the paraband, whatever you want to call it. Remember now, it is cinching down at the cervix, like the Elizabethan collar on a dog. It works best with dual cure bulk fill because you can fill it quickly with the dam off. We have saliva control to deal with here. So bilateral cheek shields, right and left side, and then we put that Svedopter thing called the Sveflex from Practicon under the tongue for saliva control. We freshen up the bond, and then we can fill it because this is so fast, there's no risk of contamination. And there's the overfill again. Well, we're a little bit above 10%, but it's amazing what you can do with discs to flatten that out, remove the growth, and then come in there with the proper burr, the acorn. That's the medium acorn. We're going to create the marginal ridges, the triangular ridges, all the stuff that you were trained to do. So once you do that, you replicated all those cuspal angles, you can fancy it up a little bit with this little acorn. It's the same angulation. So you can use it for secondary anatomy, you can use it for deepening without taking a big wide swath, and then you can finish with your 15 micron Christmas tree burr. Remember, that's going to polish as well as modify. And that's what we use now. And notice that the diamond freeze zone on there protects the remaining enamel. But and second thought, I would use the 50-50 because then I'm not going to bump into anything and I'll still get the finish I want. So the safe zone, it protects it from scarring. So remember with the Christmas tree, you got a 50-50 version, 50% diamond, and you got an 80-20, 80% diamond, 20% stainless. So run the bristles in at 20,000 RPMs into the pellet of the nano diamond and go in there and hit it multi-directional. Run those bristles against that composite and then run the dry buff against it. You get a pretty darn nice shine. Anatomical too. And look at that. Here's what we started with. 3 miserable failures with GI. And there we got it. We're sealed. Just try to do that with a cold paste increment. Just not the right way to do it. Okay, this is another MacGyver type thing. Now, you couldn't MacGyver without these materials because there's just certain things you can't do, like I said, with silicates and amalgam. With this one, we're going to be able to fill that very nicely. Got a rubber dam in place. Love that BN handpiece, running slow, taking out decay, respecting the hard dentin. Same wedge that BioClear sells is the clinician's choice. Convexi T is the band that used to be the old Dixieland band, has pre-contours in the mesial and distal. Distal lingual margins beveled as well as the cable surface margins. Again, etch and bond 3M. This is something I would not work without. It's a signature set by Dan Kim, Contact Easy, now sold through direct to AB. The reason I mentioned this is that he started this system with one strip, a black strip, and it was for finishing, adjusting contacts on ceramic crowns. And when I introduced this at school, I almost got laughed out of the room and people said things like, "You're going to open the contact." I said, well, read the directions and try it. Try it in your practice if you don't want to try it here. 2 weeks later, you'd have think those naysayers invented the product, and it's still in use at Pacific. The thing I like about it is that it has all sorts of subgingival strips. You can get down and attack any kind of an overhang you have there and not affect the contact because you slip through the contact with a diamond coated part of the band, and then you go to a very thin band. Thin when I say not tall like the other ones. So there's the finish on that. Could have been done a little bit better with the polish, but pretty darn good for a resident. Okay, this is what my residents face weekly. No insurance, that's the least of their problems when they're dealing with this. We're doing an exam, and this is one of my crack residents. I said, you know what? This woman came in holding her hand over her mouth. Let's let her leave here with something that makes that look better. It might not be perfect, but we can at least fix that in the tooth next to it and recreate that diastema. So let's get my pin kit. I love these little fill pins because they are tiny and they are titanium. So we're not having the same problem that we had with the brass ones. So I call this a belt and suspenders, and Gordon Christensen calls it a belt and suspenders. He's the one that told me about fill pin. So the bottom line is once we have the fill pin in, we etch and bond. All you have to do is hold the matrix on the lingual because you're so quick to fill this. And then we have what we have. She left so happy, tears in her eyes. She came back, we did the other one. Now, true, it's not multi-chromatic. It doesn't have mamelons. It doesn't have this and that. Not that you couldn't do that, but we had to get this done and make her happy. And she was very happy. When you see tears, they're happy. So this is me now. I'm unhappy because I'm lateral packing. That onlay was done on number 17, and I got that ugly composite there. So I went to my friend, BioClear regional instructor, Josh Solomon. I said, I know you're a pedodontist, but I know you're darn good at doing BioClear. Can you do this as a BioClear? And by the way, you're going to be building it to oppose the one that David Clark did on number 14 7 years ago. He said, cool. And the other thing I'm going to do is I'm only going to numb one tooth. We're going to use a French injector. I said, wow. I said, that sounds like the successor to the X-tip. Well, it is. So 20-year-old composite. We left composite on the pulpal floor where no caries or leakage was present, but it's a big prep. You can see that. So he's going to ensconce that tooth with composite, and he's going to use bulk easy. So there's your finished result. Not much anatomy because he's concerned about the compression dome. He could have put some in with that large acorn because it doesn't cut deep, but it's opposing David Clark's that also has no anatomy. So the bottom line, I said, that's fine with me. I just want to get this done. Can't feel the margin on it. And if you don't want to weaken the compression dome, this is what you do. I mean, you listen to people like Graham Milicic or Ray Bertolotti, Dave Clark, Gordon Christensen. They're all saying compression, not tension. Now, it's interesting. You can see on 13, and that was done in my old office, prosthodontist, guy that bought the practice. He's an exquisite operator, and yet doing incremental cold pack. You see that we're starting to get a little bit of an opening there, and you can see the knit line about halfway up. That's called a knit line, and that's a pretty obvious one. And if you look at Richard Price's studies on composites, you know what a knit line is. Now look at the margins on the one that Josh just did and the one that's now 7 years old that David Clark did. They're chewing against each other. Did a beautiful job on it. Well, this is what I was talking about. This replaced the X-tip in my mind. I worked on the X-tip with Mike Feldman at Osteoscientific, and I sold the project to Ben Johnson for endos. And it was a great system, but it is nothing compared to the Quick Sleeper. He used 1/3 of a carpule of Septicane with 1 to 200,000, and I was numb. And I had no numb lip, no numb tongue, and you could see how deep that prep was. So if you don't own one of these, consider doing it because all these sell points are true in personal experience. And this is what it looks like. You have no plunger, you have no gun. You just pick it up and it's controlled by the foot pedal. Thanks to AI technology, it actually senses how much pressure you're putting on, how much back pressure it is. So you can't screw up. And the trephination through the bone, I didn't even feel it. And he's through. So there you go. So what about the Rondium Quick Connect? Here's the system. This is what we're going to show in the hands-on. And look, I get the carrier on there. It's like a Tofflemire. I just push the back of it like a syringe, pops right off. So here's the 35 micron band that has no tabs. I like the tabs because when we're doing these big ones, I want a good contact. And you can see how they fit. You can use the regular without the tabs or go to the tab. The main issue is how to bulk fill while pushing the matrix from the inside. You can't do that. You have to pull these. Don't push. Pull the little tabs and bond it to place, either using Damn Cool from Danville and also probably available soon from Golden Dent, or by the SDI barrier, gingival barrier. They both work, okay? Now, here's the deep margin elevation wedge. Also comes in the kit. Look at the upper right. You can see they missed the boat. They cut it out, put in one of these deep margin elevation in. The lower wedge shows it in place, the lower picture, lower left. And now it shows the finish on the lower right. Beautiful finish. This is their sectional band and the separator wedges. The wedges are beautiful. These are pre-contoured, and again, 35 micron stainless, so they go in. So here's that, look in the upper left there, that's the deep margin elevation on that tooth. Look at that margin. And here's an endodontist using it. He wants to seal that up. So he does the deep margin elevation, and then he raises it to the occlusal. Pretty cool. If you're looking for new rings, Simon tells me that this plastic ring is stronger than the Triodent V3 ring that he developed. It's rated for 100 uses, but quite frankly, they're so inexpensive. If I did 50 of these, I'd throw it out. So here's a little Kiwi dentistry for you. Look at these guys. They're making crowns out of composite. Look at the compression domes on those. It's beautiful. I just love to see MacGyvering like this. Because remember, I'm 78 years old. If I'm faced with a $2,000 crown versus something that'll go 15 years and function just fine like David Clark's did for 7 years, I already got 7 on that one. I'm going to take that. And I can do a lot of these in the time that it takes me to prep, mill, and cement a crown. So here's that quick connect anatomy band. I'm showing you this because I want you to see how we develop these sculptors. Special thanks. I'm not artistic, but I can carve in planes. I can get pretty artistic. What I'm showing you here is that round burrs shaping that ditch, the occlusals. You go convex, you're going to go concave. The upper left is actually Ray Bertolotti's drill. I said, Ray, what are you thinking? That's going to cut a deep slit into the compression dome. So there's my original Raptor. You can see how close it is to the cuspal angles. So we actually got a patent on that. So now look at the bicuspid. Look how nicely it fits in the bicuspid. And there's that 30 flute Christmas tree that we replaced with the diamond, because the diamond doesn't clog like this one did. And then you can see, I don't want anything that's convex. And look how nicely those Raptors match that angle. So regardless, it works. So this is the system available from Golden Dent. It's truly prescriptive. Basically, you got a 50 micron diamond with a limit stop on it. You got a safe edge, and you got a diamond-free zone on the Christmas tree with 15 micron. So that's a polisher shaper. You got a small acorn, medium acorn, and a large acorn. Use the small acorn for fissurotomies, pedos, box only, that type of thing, or secondary anatomy, tidying up the anatomy like Simon did on his first one. Use the medium acorn, first-time restorations. Large acorn for replacement restorations. You don't want to cut too deep. You've got that nice limit stop there, large. It's well suited for BioClear restorations. And then look at the 50-50 Christmas tree and the 80-20 Christmas tree. So again, for larger, smaller restorations. Class 5s, class 1s and 2s. So these are sculpting burrs. I'm going to go quick through this because we got to get to the hands-on. So just think of it as a child's game of dot to dot, connect the dots. Once you have all the primary grooves and the triangular ridges formed, oblique ridges, whatever, then you just go in with that Christmas tree and polish, sculpt it, final sculpt it, and then hit it with the nano diamond. So again, class 5s, this is what my prosthodontist replacement told me she uses. This is all she uses. Now it'll be interesting to talk to her now that she has the nano diamond. So the Occlusionator Pro and the PPS under CRA evaluation, 82% related them excellent or good. So with that, we went to the Occlusionator Zirconia Adjuster and Sculptor, which now will take you from a flattened to a sculpted and polished restoration. Strauss on their patented zirconia cutting grit. It works beautifully. We use it with a lot of water at 50,000 RPMs, so you don't create a phase change. This is the nano diamond now that's available through Golden Dent. And those of you who remember Rouge for Gold, you'd be very comfortable with this because you just run it into the little pod or the little dot with the bristle brush, and then you go to work. If you don't remember Rouge, just follow the directions. Remember, 20,000, just vary the pressure. If you're doing composite or lithium disilicate, it'll be a lighter touch than zirconia for sure. Okay, so vary the pressure with respect to the substrate, 20,000. We're getting set up here for the hands-on, available again through Golden Dent. Remember the buff, you don't put anything on. Here's the anatomy, the quick connect anatomy band. And thank you. I really want to thank you for sitting through it. I went fast, I know, and I'm glad that it's going to be available to review if you need to. You build houses in my woods, I swim in your tiny lake, but where are my fish? And we have a house up in Shasta with real bears that come and visit us once in a while. Pretty cool. All right, so we're ready to go now to the hands-on. So we will minimize this. Well, I think we will. Here we go. And I think now I can cancel it. Whoop. Lauren, you there?
Yeah, I'm here. Yeah, you don't need anything that's up there now. I would just go to the Epson thing. That's all we really need to see at this point.
Oh, there we go. Okay. Thank you.
Sure.
So the first thing we're going to do is, once I get my loops on here, is show you how to fix those tabs and make sure that you get them to pull that contact very nicely for you. Okay, let's get that camera one more time. And let's go green. There we go. Okay, so the first thing we'll do is attach that tab. And let's use the Danville material first. Remember, I have put some bonding agent onto the occlusals of the bicuspid. Can we see this? Yeah, bicuspid and this. Okay, now you're going to use the bonding light. That's good. You won't need this. Yeah, perfect. My assistant helping me here. So we want to just lay a little bit of this on. I'll tell you when to go. I'm going to pull it. Once I pull it, okay, light cure. Oh, that's the wrong setting. Oh, that's good now. Yeah, there you go. Okay, that should be good for that. I'll pull that. We'll put it on here. So you can see I'm just tack welding these so that I'll have that firmly against it. Okay, get ready. Get that one. There you go. You can get a little closer with the light. Okay, good. Now I like to also, if I've got access to the buckle, I want to pull that one on too. And the reason for that is I can get a wider buckle lingual contact. Okay, cure that. Beautiful. Get right down on it now. Closer. Thank you. Great. Okay, that's good. And we'll, just for grins, we're going to put this stuff is going to be the gingival barrier by SDI. See how well that works. And of course, I would get a little bit inside the prep, which I didn't want. Okay, can't see. Hold on a minute. Okay, now hit it. That's good. Perfect. Okay, and then hit quickly. Perfect. Okay, now I need the bonding light, and I'll do it from this side and make sure that those are nice, firmly in place. And it's wedged. Lauren, can you hear me?
I can hear you fine.
Okay, good. All right, that's good.
I wanted to also just mention to people, if you want to, like, he can't zoom it in, but on the top of your GoToWebinar control panel, there should be a zoom. And if you hit the plus sign next to it, zoom to, you can change it to 150%, 200, whatever you want, if you wanted to zoom in and get a little closer look at it.
I think what I can do, Lauren, is zoom in myself.
Okay, that works too. Whatever is ideal for you.
Because now we're filling.
Yeah, it's a little fuzzier when you do it like that, but it's not bad. We can still kind of see. Maybe there we go. Beautiful. That looks great.
Great. So now what we're going to do, I'm getting my bulk easy ready here. I'm going to bleed a little bit off. That's important, to bleed off. Don't just go right into the needle. Okay, so now I put my needle on. This is a 19 gauge. I could use a 20. Like I said, if I'm going to bend the needle, I'm going to bend it around something round. I could go 180 degrees with this if I wanted to, as long as I bend it around that. Now, basically, I'm going to show you a test unit here. This is what I call the trifold mold developed by Richard Price. I'm going to fill this just to get the feel for this material. And then we'll look and see if I formed any knit lines in here while I'm waiting for the other one to set. Okay, we'll set that aside. Now we'll go into here. We won't need any light yet, Nance. Matter of fact, we probably won't need any light at all because this is a total auto cure at this point. So 60 seconds. And I'm going to do one other thing. Notice I'm not pulling out of that pool of material. And the reason I'm not is I don't want to create a problem. So now what I'm going to do is I'm going to go into the, let's zoom in a little more and click. Okay, now I'm on the deep margin elevation portion. So I got to get in like this so I can see. I only want to fill it up to the top of that band. So it's all setting now, 60 minutes. Start the countdown, get the handpiece ready, and then we use the Dyson suction. No, 60 seconds, I'm sorry. Did I say 60 minutes? That's what happens when you go fast. Oh, I didn't want that much. So we're still setting. 90 seconds is ultimately hard, but 60 seconds you can actually pull the band off. Okay, that should be good. Let's focus. All right, we'll do a little test on the material. Still setting. That's setting. Let's see if this one, this is our first one. This is pretty hard. So do you see what this thing does? We call it a trifold mold because it allows people to learn to inject these All you have to do is open it now, and you can see your margins. So it simulates an MOD. It's not quite set. It's Richard Price's invention, made by Ultradent. You can actually buy it. I don't think they sell them yet. It was done as a research project. The other thing I should have shown you is how I like to take a very light brush and pull the material. Okay, so we should be now this is room temperature. We take a little bit longer, 60 to 90 seconds in the mouth. Goes fast. So you get to check a hygiene or whatever. Maybe that's not enough time to see it. It's gelling now. It's almost ready. Some of the other concoctions are even slower than this. So 60 to 90 seconds, I think, is reasonable. And it's something that you'll find works pretty well. Here's the birth system. Again, made by Strauss. Yeah, nobody knows Strauss. And the reason nobody knows Strauss is because Strauss is an industrial diamond manufacturer. They also have a dental division. And I think that's why Strauss makes such a good system. None of the majors could figure out how to change my Raptors for me to get the things that are on here. They just couldn't figure it out. So I just ran into these people at IADR, and they said, we can do that. It's not a problem. So one fell swoop, and I had my working models. By the way, this is the way this thing looks. And then when I want to take this off, attached. So this is also one that was done at a prior event, and it's a large MO, and it was shaped. This was actually one of the students, and then polished, passed. Let's see how we're doing here. Okay, we're set. Now I take a hemostat. That's my favorite instrument. I was asking a question with some people at this Zest Mastership. If you only had one instrument and you're lost out in the wilderness, what instrument would you like? And I said, hemostat. Stop an arterial bleed with the hemostat. And you can see how nice it is to pull this up. It's got a lot of traction there. Now let's see if we can pull it up. See how tight our contact is. Ooh. Gonna loosen it. You can see we got pretty tight contact, okay? Now, Nancy, if you will turn on that suction, I'm gonna start to shape this. Just get as close to me as you can. Like right here, that's good. And I think I'll turn this light on. Is that whited out?
Yeah, we can see a little bit better there.
I can work without the light. I got to get my foot pedal adjusted here. And I'm going to turn this on. So I'm going to turn that light off. I've got enough light on this that I can make this. No, that's okay. It's okay. So what I'm doing now is just shaping the bulb. And again, I would like to be using water right now, but because I'm working at home. I just finished that, okay? Now we're gonna switch over. I'm gonna go to the acorn burr. I'm gonna turn this on again. I'm gonna tip this a little bit so I can see better. Better? Thank you. And then we need to cut in some cuts. And we do have a 5th tusk here. So we'll cut that in right away. And we've got a little tusk angle going here. Thank you. Yeah, just if I vary that, just push it in the right direction for me. Okay, we got enough of that going on. Now we'll take the 80-20 and we will start the final shaping here. And turn it back on. Now I'm using the polishing, the 15 micron polishing diamond. So just get everything cut in as well as you can. Okay, and then we go with this. Okay. Thank you. Just keep me on track. Switch side. One more of these. We should be ready then. Pivot. Really, I'm gonna stay on there. Okay, final shaping. Let me blow that off with that air can there. You see that air can now? This one will seal. Clean it off. And we'll just do it over here. Okay, the final we do with this small acorn, and then we can hit it with the nano diamond. And that will give us our final. Fall asleep yet, Lauren?
Beg your pardon?
Did you fall asleep yet?
No, we do want to try to wrap it up maybe in about 5-6 minutes ago. So I want to make sure that, 'cause I know Jason wants to make a special offer, and we also want to leave some time for the Q&A. So
Perfect. Well, I'm just doing the final groove here, making it look more like a suit. This is what I had Simon go back and do on his. We okay here?
Yeah.
Thank you, Nancy. Okay, blow it off. I'm gonna put on it. Okay, Lauren, we're almost there. We're close now. Okay, so now the nano diamond. Start running it in at a slower speed. For some reason, that's not latching properly. Fortunately, I have another paint piece. Okay, so we run it in, load it real well with the nano diamond. Two. A little more on there. Okay, nano diamond is done. Then we put on the buff. And away we go. And then we can also open up that. Okay, you can see the shine come up on here. We'll focus that more. And of course, if you're using water with these burrs, it just works almost 100% better. Okay, you can't find the margin on here, which is what we want. And we now have a nice high shine. Let's put this on there, blow it off, and focus a little bit. And let's bring it in a little more. Okay, there's your high shine and an anatomical form. Now, of course, you'd be adjusting this in the mouth quickly, but I don't know how long this took us. We estimate 20 minutes in an ideal situation. And what I want to show here is now this, because this really tells it all. Not one knit line in there. Let's see if I can focus that better. So this shows you how well you injected. And again, Richard Price developed this as well. He also developed the woodpecker. Woodpecker has become my favorite light to use Jason would be glad to send you the research on the woodpecker. It's worth the read because I don't think, I was a big Velo fan before, but I couldn't justify buying the Velo when I know I have something better that will do an equally good job, better price-wise especially. Okay, I can't think of anything else we wanted to do other than maybe show this. How are we doing, guys?
Little, yeah, maybe to focus that a little bit. I think it's hard when you're that close.
Yeah. No, that's not going to focus on that.
So I do want to, if you're ready to wrap it up before we get to the Q&A, I do want to turn it over to Jason, if that's okay with you, Pat.
I think that's good. I think we have shown what we're going to show, the deep margin elevation, the crown in the single visit, the geezer crown as we call it. And I think that's
okay.
That's unpolished zirconia. Can I just quickly go over that occlusal surface on the zirconia crown, Lauren?
Well, we're really running tight on time, to be honest with you. So if it's okay, I definitely wanted to do a little housekeeping and then turn it over to Jason, if that's all right with you.
No, that's fine. That's fine. Got
it.
Okay. Thank you.
So this is fantastic. I would remind people that if you have questions, we still are going to have some time at the end for a Q&A session.
Okay.
For those of you who may have logged on a little bit late, as a reminder, the webinar is recorded. That recording usually goes out within a few days. Golden Dent, who is our sponsor, is handling the CE credits. There's nothing that you need to do. There's no registration or test or anything like that. They will see when you logged in, when you logged out, and as long as you were here for the bulk of the webinar, you will be able to get the CE credits. That usually takes about a week or so. As I mentioned, we don't do these webinars without sponsorship, without a company that's bringing in these amazing speakers. That's Golden Dent. So I wanted to turn the screen over to Jason Phillips from Golden Dent. They typically are going to have a special offer and some educational opportunities. So Jason, I've put it onto your screen, and then you can take it away, and then we'll leave time at the end for some Q&A. Go for it.
Thank you, Dr. Levine. My name is Jason Phillips from Golden Dent. Thank you, Dr. Roetzer, for putting on a great class tonight. We're happy to have you on board, and I thought that was a very good period of instruction. So, here's our information for ordering. Tonight, we're offering a 15% discount site-wide. Excludes 5+1 deals or other existing promo items. The code is COMP15 or COMP15, and that's good for everything except for the exclusions that I mentioned. It's a 24-hour deal, so it expires end of day tomorrow. 24-hour deal. So please take us up on it. We don't give great discounts every single day of the week, so it's a good time to buy. These are the featured items that you saw in Dr. Roetzer's presentation. We have his designed Occlusionator Pro Burr kit. It's normally $101.97, but with the webinar discount tonight, it's going for $86.67. And on top of that, we have the Nano Diamond, the universal polishing compound. It's great stuff. I mean, a lot of different companies say they have a universal polish, but Dr. Roetzer has shown through demonstration, and then in lots of discussions between the two of us, it is an exceptional material. And so, hey, take this opportunity to try it out. You saw it in practice, and you can put it into your own practice. So, the other product that Dr. Roetzer showed was the Quick Connect, designed by Dr. Simon McDonald, the inventor of the Triodent V3 system, among others, and the founder of the old Triodent dental company. It's a wonderful system when you look at it. A nice specialty Tafelmeyer, very versatile, as Dr. Roetzer showed. You've got tabbed which you can go ahead and pull your contacts instead of the old push with you know, burnishing and whatnot, or you can choose to use the non-tabbed versions. Both versions are contoured, so it'll give you that nice replication of interproximal contour when you're doing your composite restorations. Try it today, 15% discount, normally $173, but tonight or the last 24 hours, or the next 24 hours rather, $147. Get you started with it. Also, Dr. Roetzer, showed the deep margin elevation wedges. It's actually a very clever wedge. You know, there are other products on the market that you might have seen from other companies that do, you know, deep margin elevation. This one's probably the most simple, quite frankly, because others, you know, you have to use some sort of band. This one, it's just a wedge. So, you know, you want to try them out. They're regularly $51, but tonight, 15% webinar discount, almost 44 bucks. So you can go ahead and give those a try as well. So, you know, we do have several matrix offerings, you know, and I'm pretty sure everybody out there who's doing direct restorative composites is using a matrix of something or some style. So Golden Dent, we have our disposable single use, the little purple ring that you see there at the top left. And then we also have some Triodent V3 style night tie rings that you know, we sell. They're very, very popular. Probably about, I don't know, 40–45% less on average than the name brand. And, you know, things aren't getting any cheaper out there, and especially for dentists. So, hey, try them out, see if you like them. Again, you got the Rondium Quick Connect retainer Toffelmeyer system that we're showing. Also, we've been, you know, selling the Monoblock bite blocks, and that's from a Dr. John Garrison. You might have heard of that company before. You know, they're a great seller for us. Everybody loves them. They've got the perfect angles on there, and they're autoclavable, so, and reusable. And we do have our Wagotrix sectional matrix kits. The kit that you see right there, actually, we sell a kit that has night tie rings and disposable rings if you want to try them out. The matrices themselves, they are essentially the same shape or same dimensions and thickness as the old V3 tab matrix. Same thing with the wedges. They're very, very similar to the Triodent Wave wedge. A lot of fans out there for that system, very basic and inexpensive. So what's new besides what we've already talked about? So we've got the, you know, I would say, you know, not that I'm a cosmetic dentist or clinician, but in my experience, the Polydentia Unica anterior matrix system is probably about the best one you can try out there for your cosmetic work for anteriors, especially if you need to, you know, crank out a few you know, composite veneers. You got you know, somebody who's going to get married in a couple of days. Instead of having to rush the job to a lab and have to pay through the nose, hey, you know, you can work them out with the Unica kit. They are wonderful, and you know, it's one of the things. Garrison, you know, they have matrices of all sorts and shapes and sizes. But you know, the one area where they're not on top is the anterior matrix, and that's where the Unica comes in. We've also started to pick up, or actually just picked up rather, some of the Exacta dental products. So we've got the Exacta Temp that we just picked up, and you'll see it on our website. In addition to the Exacta trays, which is, you know, it's a triple tray style, tray. We've got them in, you know, anterior, full arch, quadrant, and you know, all your double bite needs. And you know, it's very similar to the Premier ones. I think there was an argument of which one came out first, but they're great, much better price than the Premier ones. And then you see right there, we've got our little bite block there from Monoblock. And then finally, we have the Wizard wedges. So, you know, the short story on that one is, if you recall the fires at the beginning of the year, the old Wizard wedge factory, was in Altadena, California, and then it burned down, unfortunately. It has since been rebuilt, and Golden Dent has partnered with the new company. It's Docum. It used to be carried by Waterpik for decades, and Waterpik decided to not pick them back up in lieu of something else. I don't know what. But these are the original Wizard wedges, and they are available from Golden Dent, either the original Wizard wedges, and we also have the original anatomical Wizard wedges, if that's what you're looking for. As Dr. Roetzer mentioned, we've got the Woodpecker X-Star Curing Light. It is a wonderful light. If anybody wants the study done by Dr. Richard Price at Dalhousie University in Halifax, Nova Scotia, I did a very extensive test comparing it to the Ultradent Velo line of lights, the Velo Grand and the Velo X-Star. You know, if you were out there looking for a curing light, the Velo X-Star runs almost $2,300, and the feature set for the Woodpecker X-Star it's near identical, except the price is not near identical. This one is $997. You buy today with the 15% discount, you're gonna get 15% off of that $997, so it's a good time to buy. Let's see here. Also, you know, just coming off the heels of a very successful AMP training this past weekend in Detroit. This is that Golden Dent puts it on. It's amplified dental training. It is one of the most comprehensive hands-on courses with live patients. There's nothing else really like it in the United States for practical hands-on dentistry. If you're looking to learn extractions, grafting, anything like that, it's the way to do it. It's a 2-day course. 1 day it's a classroom setting, and then the next day you go to a dental school, and you're working on patients that Golden Dent recruits. And you know, if you know, we've had a lot of people come through, they lost their local oral surgeon to a DSO or something like that, and they, you know, somebody wants to keep more work or business inside their office. It's a great way to do it, and a very low price as well. So you go to amplifydental.com, check it out if that's something you're interested in. And this is our schedule here. As I said, we just had one last weekend that was sold out. But as you see here, you've got the AMP1, which is it's not a basic course, but it's your intro course. And then AMP2 has got more advanced training, and they're all 2-day courses. As I said, 1 day in classroom, the next day in the operatory, getting to work and learning how to continue building your practice. And our next webinar is on Tuesday, February the 3rd in next year, 2026, and it will be Dr. Tim Kaczynski. He's a longtime lecturer for Golden Dent, also currently lecturing for Glidewell, among others. It will be an extraction and grafting course that we're putting on 1 hour of CE. It starts at 8 p.m. Eastern. You can go ahead and sign up. And again, February 3rd, 2026 at 8 p.m. Eastern. And one last time, that's our contact info. We've got our phone number there, 586-585-1210. We have a chat feature on our website as well. And you can also just order at golden-dent.com. And again, it's 15% savings for the next 24 hours. Code is COMP15, COMP15, and it does exclude any existing promos or 5+1 deals. And with that, I will give it back to you, Dr. Levine. And thank you, Dr. Roetzer, for putting on a great course. We really appreciate it. And that's all I have.
Thank you.
Thank you, Jason. I appreciate it. So we normally have 2 types of webinars. We have our standard webinar where we have dozens and dozens of questions. And then we have those select few where they're so comprehensive that we have no questions, which is actually a good thing because we're running towards the bottom of the hour here, which is when we normally start to wrap it up. And there were no questions. So I do want to be respectful of everyone's time, as well as Dr. Roetzer and Golden Dent. So Pat, I'm going to give you the last word before we wrap it up for the evening.
Well, I'd just like to thank everybody. If you have any questions, you can call me, my cell phone, or you can email me, and I can answer your question directly. If you want to prefer a phone call, I do this a lot with my former residents and students, and I would be more than willing to return that. So I think on the video is my phone number and my email.
Perfect.
Good.
Well, we want to thank you for sharing your expertise with us. It's very rare that we do these hands-on courses, and I think we should do more because it really gives people a we were there type of moment to really feel that they could get a true understanding of all the techniques and all the little tricks that go into that. And we feel really honored that you were able to share your expertise with us this evening.
Well,
as always, yeah, go ahead.
I appreciate the opportunity.
Sure. As a final thank you as well to Golden Dent, I've had the privilege of working with Kurt and Jason for well over a decade. They're always bringing in amazing speakers. If you saw the slide about our next webinar, February 3rd, all of you who are here this evening have been added to that invitation list. So you will get invitations for that. We usually start sending them out about 3 weeks ahead of time. So around second week in January, start looking for those. As a final reminder, the webinar was recorded. That typically goes out within about 2 or 3 days. The CE credits, we record when you logged in and when you logged out. There's nothing you need to do. As soon as you're done tonight, you can just log out. There's no quiz or registration or anything like that. Golden Dent handles sending out those CEs. Oftentimes they can get them out as early as Friday, but with 300 plus registrations tonight, don't be surprised if it takes some time until next week. If you don't have it, say by next Wednesday, by all means, reach out to me. I'll reach out to them and make sure that they follow up with you. We thank all of you for joining us. We know that your time is valuable. I continue to do these webinars because we get great turnout and great responses. And if any of you have any topics or things that you want me to be featuring next year, by all means, feel free to reach out to me and let me know, and I'll talk with Golden Dent. And if it's clinical and it's got something to do with extractions or restorative or anything like that, it is a very good chance that they'd be more than happy to find a speaker for that. Please stay safe and healthy out there, stay warm, and we look forward to seeing all of you at our next webinar. Good night, everyone.
Good night.